My name is Jerry Ware. I'm a professor in the Department of Physiology here at UAMS. I graduated from UAMS in 1984. I then spent 3 years at the University of North Carolina in Chapel Hill, where I got introduced to aspects of blood clotting and blood coagulation. Subsequently, I spent 17 years at the Scripps Research Institute in La Jolla, California, before coming back to UAMS in 2004. Since that time, I teach a little bit to the freshman medical students. I'm one of the first people that they get exposed to cardiovascular biology, which ends up being an important part of their clinical training. I very much enjoy my interaction with the medical students. I also have a research lab that, at least for the last 20 years, has focused on aspects of blood clotting and platelet function. Now, you may have heard of platelets. They circulate in your bloodstream along with your red cells. They're small cellular fragments. And their main role is to participate in blood clotting or hemostasis, which is a fancy word for preventing blood loss in your vasculature. The same processes that we know that support hemostasis can also happen in pathological situations. In this case, it gets termed a thrombosis. Now, a thrombosis, the most common form, is a thrombosed coronary artery, which leads to a myocardial infarction, or more commonly heard or known as a heart attack, which unfortunately can be fatal. We know now in really exquisite detail molecules and receptors on the surface of platelets that help support both hemostasis and, in the pathological situation, thrombosis. And certainly for the future, a lot of this basic research has provided us potential targets that can interrupt these processes that indeed can help and prolong the health of Arkansans and also Americans at large, as cardiovascular disease is a big problem in America. I think from for the future standpoint, it's been very exciting in that we now understand that platelets not only participate in these clotting processes, but they influence a lot of other things as well. We know, for example, that platelets interact with tumor cells in your circulation, and these tumor cells are looking for places, secondary places to grow, and a process we term metastasis. Now, unfortunately for the cancer patient, the prognosis after metastasis does significantly weaken their prognosis or significantly diminish the prognosis, makes it a more severe prognosis, I should say. The other exciting thing for platelets is that we now know that they can participate in some processes that give rise to inflammation. Inflammation is so important in so many diseases. With my colleagues at Brigham and Women in Boston, we described the relevance of platelets really worsening the cases of rheumatoid arthritis. So I think the idea of these platelets that we've been studying for now decades and how they participate in hemostasis and thrombosis, the fact that we can take the same targets and be able to apply that to other disease processes makes the research that's ongoing now very exciting, and hopefully within the next decade, I'm going to, from my own personal standpoint, I'm going to enjoy sitting back and watching where a lot of this goes in terms of therapies that can help patients with some of these diseases. So I think it's an exciting time. I look forward to kind of seeing how this all goes over the next number of years, and appreciate your taking the time to hear about some of this.